Hi, my name is Brian Hanypsiak, and I'm an orthopedic surgeon here at Physicians Regional Medical Center. I specialize in surgery of the shoulder, knee, and hip, and serve as head team physician for the Florida Everblades. Hip arthroscopy is an uncommon sports medicine procedure that is performed here at Physicians Regional Hospital. It typically requires the surgeon to have specialized training and specialized instrumentation that is longer and cameras that are shaped at a different angle in order to perform the procedure. Hip arthroscopy is meant for patients who have tears of the cartilage or labrum that surrounds the socket in the hip. It's also meant for people who suffer from a genetic or perhaps acquired deformity of their hip called femoral acetabular impingement. Patients who have this typically will require a hip replacement prior to the age of 55 if left untreated. The disease in general involves a deformity that changes the shape of the ball and socket joint, and makes it appear more like an Easter egg, so it doesn't fit in the round socket. Other forms of the disease have a socket that's too large or has a osteophyte that comes off the socket and digs into the ball. This is called Pincer type femoral acetabular impingement and is typically more common in women, whereas a ball that is not round or cam type impingement can be found more commonly in men. As team physician for the Everblades, we think that hockey players acquire this early as a result of the skating motion, and we typically see this in hockey players very early. Many players will require surgery to reshape the ball and or socket and repair the cartilage arthroscopically. Once we decide to perform arthroscopic surgery, the patient is taken to the operating room where they're placed on a special bed which allows the leg to be pulled approximately 2 centimeters out of the socket. We do this under general anesthesia, and using fluoroscopic or x-ray guidance, we're able to enter the joint and repair the torn cartilage or reshape the ball and socket as needed. The operation is performed as an outpatient and usually requires 3 to 4 months for recovery and 4 to 5 months for return to sports.